Sangat television team today is here in Tenby at one of the sites which we all are aware from last March, COVID-19 pandemic, which has brought the whole world to its knees. The fight against this pandemic, which every government in the world is fighting with the vaccination. Today, we are at the Nishkam Vaccination Center, and I have with me Amik Singh Pogal, who is the main coordinator of this vaccination site. Amik Singh ji, welcome to Sangat TV.
Thank you.
Thank you very much for giving us your time. Today we are at this site. Can you just give us a background why this site has come into force?
Thank you for having us, your team, come to Tenby COVID vaccination site. As everyone is fully aware about the world pandemic and the fight against COVID-19, we have been lucky, that there's been a vaccination available. We have been lucky that the government is supportive of the vaccination rollout and actually is the world leader in actually delivering the vaccination. We are lucky we've got an NHS service that have given us the permission, given us they've actually set up this site to actually provide the vaccination to a hard to reach community in the Birmingham area. So how this site came about was Nishkam pharmacy, which everyone knows is on Soho Road, 21 Soho Road, opposite the Gurdwara. We were approached by them that how can you help to vaccinate the hard to reach community? So what they said is that at the current state where the pharmacy is, it was because of the vaccination sites around the area. It was overpopulated with vaccination sites. They asked us if we could come up with ideas or other proposals. So we were lucky that we've got Tenby site, which is only 1.2 miles away from Soho Road itself. So they agreed that this is a satellite site from the Nishkam Health Centre. So they agreed that, and actually they said it's an opportunity because Newtown is again one of those communities, an area which is very hard to reach because of the uptake of the BME community. So actually it was a double win for them as well. That we've got this space and we've got the actual volunteers, the actual professional volunteers, as well as other volunteers that could actually help run this site. So this site started functioning. It was last Saturday we started, 12th of March, and it's running 7 days a week. And if anyone wants to book their vaccination, all they have to do is either go on the NHS website or actually phone the number NHS 119.
Thank you very much, Mikji. You've just given us a brief description how this came into being and how it is now in the community. And we are seeing people are coming in, people are being vaccinated, and then more and more people are also logging on and booking their slots. Yeah. As you can see, the whole world is trying to overcome this with the vaccination program in place. And we in the UK have been very privileged that the government has been very proactive. And I think so up to today, it'll be 50% of the population, adult population, which would be vaccinated. So it is very important for everybody to understand why the vaccination is there and why we have to have it.
Yeah, we are lucky that that the government is supportive of this vaccination. As you can see with all the figures, we are actually leading the vaccination program. So why is it important? It's the only way that we can actually get out of this pandemic safely and return to a new normal, really. So this is the only way that we could do this. As we could see, many people have suffered, many people have sadly passed away. We are lucky that we actually, the NHS is supportive and actually has given us all these facilities actually provide this vaccination site, so we could deliver and help the NHS provide this vaccination service.
Other thing which really strikes me when you come and visit the vaccination center, that it's not just one community, every community is involved with it, which is a very, very big thing because the whole world is united in fighting this pandemic. And you're seeing that in this satellite vaccination center, which we are standing here today. If you can just touch on that, we have a lot of doctors, you have a lot of volunteers, fire person, name it. Everybody's trying to give their own time and help the community.
I think we are all aware and we could all admit that when COVID came,
Sure.
it didn't discriminate against caste, creed, religion. It affected everyone.
Yeah.
Because of that, we saw that, okay, now attacking this virus, I think everyone saw that if the virus didn't actually, discriminate against the creed, caste, religion, we should not discriminate against, fighting it as well. So that's why, we're lucky that, we're in an area of Birmingham, Newtown, where it's all multicultural, and we've seen volunteers come from every background to help us. This includes professional volunteers, including GPs, doctors, nurses, dentists, pharmacists, and then we've got marshals who are actually giving their time out of their professional capacity to come here and help us. Admin staff as well, coming from many fields, many different fields, just providing their giving their time to actually help to actually help fight this vaccination, fight this COVID pandemic, really. Because if you think about it, in our lifetime we probably won't see anything like this again.
Yeah.
But at least we could say to the next generation, yes, we lived through it and we actually gave something back. So this is why I think everyone has come together as well.
And again, the other very important bit is that it is a fight against it from everyone, and we all have to obey, abide in what we've been guided by the NHS, the medical professionals who are guiding us through this very dangerous, which we all are aware of. All, I think so, in the world have had someone they knew, someone they loved, who has left us with this pandemic. So we need to be really careful, really cautious, and listen and obey and do what we are being told to do.
So I think that's a really good point you've raised. This vaccine was delivered, was made, was actually researched by scientists. We're lucky that that the UK has always took scientific advice, and everything that has been implemented is on that advice. Now, I think everyone should actually be responsible enough to listen, obey, and actually practice that advice. Yeah. So that includes, like we're in lockdown now, as we know, that we need to follow the rules at the end of the day, because these rules are for our benefit. Like you said, everyone has been affected by probably, someone's losing someone's death. It has affected every family. What we could do, we could actually just follow the rules and, help another death from being actually happening. So following the rules, and getting yourself vaccinated is also actually helping to combat the actual pandemic as well.
Thank you very much, Mani Singh ji. Thank you so much for your time. Yeah. Today, now, we are joined with one of the volunteers, whom I know very personally, who's a very, very dedicated sevadar, who does tireless work with all communities everywhere in Birmingham. Linus, thank you very much.
Thank you very much indeed.
Linus, we've seen you. You've been very proactive in the vaccination center. You're vaccinating. We know your skills with the health and safety aspect. You've been a very trained person, and you're a very big part of the community in Birmingham. And you add a lot of, what do you say, even in this current climate we've gone through, your experience, your guidance has been very valuable to all the communities. You've been volunteering here since the 12th when it opened up. Why have you decided to do that? Why are you doing it?
Well, I'm very lucky and I'm very proud to be part of Nishkam Trust and the NHS service helping to vaccinate the people. I think it's excellent that we've got this community coming together from all faiths and that we're supporting one another. And I think when you find something that's of value, you have to give value yourself to recognise what's going on. With the guidance from our chairman as well, the way everything comes together, I think it's very important. Personally, with the vaccinations, I've been very privileged to sit and meet lots of people, give them their vaccine, reassure them. And I've been wonderfully supported by the rest of the community as well. So we have a wonderful team of administrators and pharmacists and doctors who all help. And I think it's just really good that when we come together, it brings out the values of what a community should be. Sure. And from my very, very little understanding of Sikhism, it's nice seeing it in action. And what could be better than the COVID crisis that's taking over the world for people to step forward and to step up?
The other thing which really, when you see that every part of the community comes together collectively and then are shoulder to shoulder, and it's such a beautiful thing which we all should also learn, because this COVID has united us as well in a lot of things.
It has. It's been a very, very terrible illness and it's caused lots of harm. And I would say to the community as well, please come forward and get your vaccination. Please get your friends to come forward and get their vaccination as well. We're all standing together against this terrible illness. Sure. It doesn't matter what part of the community you're in or where you're from, we can all do something. And as long as we all come together, we will win.
As a volunteer, I think so. It's because we've all been taught different, whatever religion we preach and we are doing. Every religion teaches us to help the needy, to stand together in a moment of crisis, and which we are seeing. And yourself, you're so much involved with so many things, which I know your health and safety record, your guidance is been a very valued part for the community, which you've been guiding the temples, the gurdwaras, how to operate in this because they are our spiritual places where we have to go. But your effort in there and now your effort in here really makes us very proud as British guys, as UK, all one community fighting together and then defeating this war.
Absolutely. I mean, I've been very fortunate. I've been able to help out with the Nishkam schools. So I've been to Wolverhampton, I've been to London, I've been to Birmingham. Sure. I'm very fortunate that I can help. Sure. And when I was here last Sunday, which was Mother's Day, sure. Now my mum died last year, but she was a nurse for many years and she was also a nun. And I thought she would have loved nothing better than me on Mother's Day to be vaccinating people. So even though I'm still a little bit sad in my heart about it, it put a big smile on my face. And I think that's the important thing. We all come together as one.
Thank you very much for your valued time, Linus, and may God bless you to carry on doing this good work, which you are always doing.
As long as we all take care and please get vaccinated. Thank you.
Thank you very much, Linus. Thank you, sir. So we have with us at the Nishkam Vaccination Centre, Amrik Singh Ji, who is a director of the Nishkam Civic Association, who plays a very big role with NHS England, Birmingham, faith leaders. Whatever the government's directive is for Birmingham is a key player, key role of his is with the community. So Amrik Singh Ji, thank you very much for giving us your time. Today we are all standing here at this Nishkam Vaccination Centre. The government has put in a lot of effort, has gone in all over the United Kingdom with the vaccination program. So your role, you've been involved with a lot of with the faith ministers and all, you name it, every role in where the government has been consulting the leaders, the local leaders, the faith leaders in their different capacities, and you've been very much involved with guiding, bringing in all for the communities. So if you can just share your thoughts with the audience from your point of view, the vaccination centre first and the role behind it.
Krishdev Virji, thank you very much for that introduction. But in all humility, we're actually very lucky to be part of the contribution and the global movement to try and help the alleviation of the pandemic and address those issues within our respective communities. It is an honor to be part of a vast pool of volunteers, not just as part of the Nishkam team, but you look at it globally. Sure. We've seen volunteers step up, we've seen faith communities step up and fill a gap where public agencies couldn't reach. So we've been able to, through those communities around the globe, see people stepping up and helping people in their neighborhoods, helping people in their streets, helping people through their churches, their masjids, their gurdwaras. So it's been a phenomenal movement. And what we have seen is, whilst we are sometimes very critical of the NHS and of the government, if you look at us in the global context,
Sure.
the United Kingdom has done really well with its vaccination program.
Certainly.
Only this morning it was revealed that we've now vaccinated over 50% of the population with their first vaccine, which is phenomenal. I think we've also heard a lot about the hesitancy of vaccination, in particularly people group it into BAME communities, Black, Asian, minority, ethnic communities. But I think we've got to address that. We've asked the faith minister and the vaccine minister in our conversations and roundtables to give us some of that granular data. What does it really look like, so that we're tackling some of those areas specifically? So at the moment, what we are seeing is the Bangladeshi community, the Pakistani community, and the Caribbean communities are probably a little bit higher hesitance than with the Sikh community. And then people will say, well, why do we have a vaccination centre? This isn't a Sikh vaccination centre for Sikhs only. This is a vaccination centre run by the Nishkam pharmacy group, and we're blessed to be part of that, to be able to get the vaccination to all those communities in the local neighbourhood in the Newtown area. So it is a pleasure and an honour to sit on roundtables with the vaccine minister, with the faith minister, and other fellow participants from around the UK, to say, what is it that would help those places of worship, those faith communities, to be able to play their part actively and proactively to help fight the pandemic.
Ricky, the other thing which touches you quite a lot when you walk through the center and you see the volunteers from all communities. As you were mentioning, it's very nice to be part with everyone. You were seeing that practically in this vaccination center.
When this vaccination centre was still in its infancy, being planned with conversations with NHS England and the local colleagues, one thing our chairman, Baisav, Dr. Mahinder Singh, OBE KSG, made very clear is we've got to practice what we preach. We're doing Sarbat Dapala, and for us to do Sarbat Dapala, we've got to involve everybody. Sarbat Dapala meaning the welfare of all. So if we're doing the welfare of all, we've got to allow those people who want to volunteer from other communities. So when we put the invite out for volunteers, and I put an ask out here now, if anybody wants to volunteer at the vaccination centre, please email COVID-19 at nishkampharmacy.com. They're very, very welcome, and somebody will be in touch with them. And we're welcoming clinicians, admin staff, stewarding staff. So anybody who wants to get involved, more than happy to welcome them. And that is the important message we've got to get across. It's important that we involve all, because just as the vaccine is only as effective as when everybody's had it, we've got to A, take it ourselves, and B, encourage others to take it. And the way you do that is where the vaccination centres represent the local communities, and people can see people like themselves at the centre. And I was very impressed to be welcomed by Sheikh Nuru, who set up the vaccination centre for the masjid. When we went along there, it was a real pleasure to see the involvement of volunteers, and volunteers stepping up, just as we've seen here today, and you'll witness as well.
And the other thing I think, so what we also got to keep in mind is that with this COVID pandemic, it has shown the world that we together can fight it. And it is important that we also take some responsibility, because you can see the governments, the NHS, because nothing you can plan for these things. You've been caught out in so many things, but credit where it goes, the NHS, what they've done in this war and carry on doing still. The government, certain decisions will people think they were done right. You can never be right or wrong when you're fighting a war like this. But when you look at, if we can help offload some of their headaches in these things like these vaccination centers, communities coming together, it really helps everyone. And it takes that little step forward quicker to reach the aim, what we want to vaccinate the whole population.
Hindsight is a great science. retrospectively, we can criticize every decision because we're wiser now than we were this time last year.
Definitely.
If somebody had given us the data, if somebody had given us the knowledge that we know about COVID-19 this time last year, we wouldn't have lost all those loved ones we've lost.
Sure.
Nobody wanted to use those people as sacrificial lambs while we did our experiments. But that was the trajectory of our learning curve that we had to go through. And if you look at how quickly the vaccinations were developed, and that was only through companies, countries putting aside their differences and sharing their intellectual property rights, sharing their knowledge and allowing other people to excel. So that showed us what we're taught in Sikhi. It's about togetherness, it's about collaboration, and we saw some amazing collaboration. But when you also look at the roles that have been played, I think what the pandemic has done, it's exposed some real inequalities across all communities. But it's also given us the opportunity to raise our game and get involved. And we've seen communities get involved that wouldn't normally get involved in the sort of service we're seeing, whether it's serving food, delivering food parcels, getting involved in vaccination centres. Only yesterday, the World Health Organization held a conference, a webinar, with the Religions for Peace. And we're very privileged that Baisaji, Dr. Mahinder Singh, was part of that conversation to take home a message to the World Health Organization to say, look, faith communities can be part of the solution. And this is what faith communities can bring. As well as we know that Sabr Awqad Nam, we know that prayer is a great ingredient for cure. But as well as that faith element, there's also the practicalities of mobilizing faith communities to get involved physically in the vaccination system. So we have seen a lot of communities coming together, pulling together to make that difference.
To the last point, I think so. We should, wherever we are watching this program, we should all in our prayers pray for the well-being of all who are fighting united, saving lives, treating those very, very ill patients, which your eyes cannot see day in, day out. We see on our television sets. Pray for everybody, that everybody is healthy, wealthy in their own families, and we overcome together this pandemic, and history will tell how everybody collectively fought against it.
You know, if I think back when the pandemic broke out and there was a sudden urge and shortage of bed space, the Nightingale hospitals were opened in London and Birmingham. And from here, we were able to work through our chaplaincy teams and our Sikh Rogi Asra teams to support those hospitals and step up and say, look, if there's any chaplaincy needed, if there's any support needed, any bereavement services needed, we're here, call upon us. I was invited to the Birmingham Nightingale Hospital. And rather than go on my own, I took with me a cohort of interfaith colleagues. So I invited the Christians, the Jews, Muslim community, and the Hindu community, and the Christian community. And each of them willingly came along, and we went to see the Nightingale Hospital. If I tell you that when we walked in and saw those beds, row after row after row after row, you cried. You couldn't help but cry to think that potentially we were planning to have all those filled with ill people. By the grace of the Almighty, they were never called upon to the degree that was required. But what it did show was the way the communities, the way the public agencies, NHS England and the government had pulled together to pull out the stops, to make a difference and prepare for the worst. Because it's only then that we can be ready for whatever's coming. And we were dealing with the unknown at that point. So when we got the communities to work together and they collaborated together, we saw some phenomenal support being offered from all communities to members of their own communities by way of chaplaincy, bereavement support. And that is just so important. And we applaud them. We applaud them for all the hard work they do on the front line. We know we've lost many doctors and nurses, and which is why it's so important that now that we see a chink of light in the vaccination, that A, we take it, and B, we educate people to take it. And if there are concerns out there, there are plenty of avenues to get some help. Speak to your GPs, speak to your loved ones, speak to somebody about getting the facts rather than the myths and the scaremongering that we are seeing with regards to the vaccination. Thank you.
Thank you very much, Amrik Singh ji. And may you carry on doing the good work which God, Waheguru, has blessed you, and may you fulfill in carrying on your duties. Thank you very much. Now at the vaccination center, we've got a very valued guest, a practicing GP, a volunteer at the vaccination center. Teresa, thank you very much for joining us.
Thank you.
You're a practicing GP, you're helping out here in the community. Why are you doing this? If you can just share your thoughts as a volunteer here.
Okay. Well, I think, it's been a very challenging year for many of us in healthcare. And it's come with sadness and challenge. And so to be able to do something positive, where people are grateful and positive about things, is quite uplifting. And that led me to decide to volunteer to help with vaccinating.
And as the whole world has gone through this COVID pandemic, and we've all been suffering from it. And the role the doctors and the medical profession has been the key in saving lives and protecting us. A lot of wrong myth also goes that you shouldn't want the vaccination and all that sort of stuff. As a medical professional, what would you advise to everyone? Because Sangat TV is being watched all over the world, all over the UK, especially our communities. Sometimes they don't watch other programs. What would you like to say to them?
I mean, with anything in healthcare, any medicine you take, paracetamol, anything, there's obviously a slight risk and benefit to what you take. I think we know now that the advice is that overwhelmingly the benefits outweigh risks for this vaccination. And in terms of protecting ourselves, our loved ones around us, and helping society shift back towards, some type of normality, the vaccination is the way forward, really.
Sure.
Yeah.
And the other thing, what we've seen at the vaccination center, we walk through, and we've seen the community spirit. Everybody from all communities joining in together, fighting it together to protect everybody, and which is a thing which I think so. This COVID has brought to everybody's senses that we have to fight it together. Your experience leaving alone the GP practice side as a volunteer, when you mingle with everybody in here, you got a fireman, you got a doctor, you got a dentist, a nurse, a student as doing the admin work. How do you feel with that?
Yeah, I think because I have vaccinated in different places, and I think coming here to the Nishkam COVID-19 vaccination centre has been hugely inspiring for me. And because, like you said, it's largely run by volunteers here. And all of us working together, giving our time, just shows, as you've said, that all human beings share the same feelings in terms of helping one another and trying to, want to protect and care for everyone around us.
We all pray for the well-being of yourselves, people like yourselves who have dedicated day and night serving the community, where you're dedicated to that. And again, your spare time, you're coming out here and helping. We haven't got words how to thank all the NHS, all the professionals in your line who are working day in, day out for that.
Yeah, I mean, I think, it's a vocation, isn't it? And that's why you go into the profession.
Sure.
And more than ever, this last year's shown me that. And yeah, it is very fulfilling and inspiring to be able to help others. Yeah.
Thank you very much. May God bless you. Thank you so much for your time.
Thank you very much.
We are now joined at the vaccination center, Dr. Manveer Kaur ji. Dr. Manveer Kaur, one of our very professionals who've been very blessed as a profession in being a doctor, serving as a doctor, and also serving the community. She's a very vital part with the Nishkam pharmacy project, and she's a key player in this vaccination center. Manveer ji, thank you very much for joining us at Sangat TV.
Thank you so much for having me. Vaheguru ji ka
Khalsa,
khalsa,
Vaheguru
Vaheguru
ji
ji
ki
ki
fateh.
fateh.
Manveer ji, we are at the vaccination center, and obviously we've talked with a lot of the other guests, and the COVID pandemic has really changed the world. And the fight to finish it, the fight to win it, is the vaccination, which all the countries in the world have developed, and now mass vaccination is going on all over the world. And UK is the leader at the moment with that, and we are standing at one of the sites here. So if you can just share your thoughts with the vaccination, why you think it is necessary.
Thank you. very much for, first of all, having me here.
So much.
I think, Uncle G, one feels very humbled and blessed, in fact, to be allowed to contribute through service in collaboration with the NHS
Sure.
at these COVID vaccination centres. The vaccination centres, or the vaccination itself, is a fundamental part of our human fight
Mhm.
against the COVID-19 pandemic, because it gives us a glimmer of hope. And as yourself had said, the UK is leading in this fight and in the vaccination program.
Mhm.
And one feels very grateful to the NHS and to the United Kingdom
Sure.
to really be prioritizing our safety through pushing the vaccination program. And therefore one says thanks to the NHS.
Yes, definitely. A big thank
For
you.
sure.
Yeah.
The vaccination centres are really fundamental. The one in Newtown, I would say, is especially important.
Mhm.
So from my perspective,
Sure.
so the Nishkam Pharmacy and the Nishkam Healthcare Trust, where we volunteer and do seva, is based 1 mile down the road on Soho Road.
Okay.
But we were very happy when NHS asked us to help and collaborate with them in opening a vaccination centre in Newtown,
Okay.
because there was no local vaccination centre in this
Yes, yes.
area.
Sure.
And an important part of the vaccination program is, one, people to be aware of a vaccination,
Mhm.
to understand its importance, and then to have easy access
To the-
to the vaccination
Definitely.
centre.
Yeah.
Hence the importance of local vaccination centres.
Okay.
And this is the medic within me speaking. I feel especially privileged that we are serving here, because putting things into context, 14% of UK population is of a BME background, BME Black, Asian, minority ethnic groups.
Okay.
But in Newtown, 75% of the population
Okay.
is from a BME background. And we know from the last 1 year in the news, COVID has disproportionately affected BME groups.
Sure.
There's been much higher mortality, death rates,
Mhm.
much higher sickness rates in the BME groups. And therefore, to serve this population through vaccination is really important. And also vaccinations are important, Uncle G, because when we get vaccinated, we
Mhm.
protect, of course, ourselves,
Sure.
but we protect those around us. So vaccination is important because we need to develop herd immunity.
Hmm.
Herd immunity refers to a mass population being vaccinated and therefore minimizing the rate of infection in that population group. So if, for example, the entire population was infected, then everybody in that population is less likely to be infected with coronavirus,
Okay.
and therefore they're less likely to give coronavirus infection to somebody else.
Sure.
And therefore, we're more likely to go back to some sort of normal life. If only, for example, 50% of the population are vaccinated,
Mhm.
well, 50% are still spreading a lot of disease to one another,
Sure. Sure.
and we remain trapped in the cycle of lockdowns and so forth.
The other thing which we've seen here, we'll walk through, we've talked to a lot of your colleagues, and you find different community professionals giving their time, coming in and doing seva. As Sikhs, we are very proud and privileged when you see our youngsters who are qualified, educated, and are great leaders in their workplaces and in their field, dedicatedly giving their time, as Maharaj has advised, given us the say of the swanth, ਚੰਗੇ ਕੰਮਾਂ ਲਈ ਚੰਗੇ ਕਾਰਜਾਂ ਲਈ ਆਪਾਂ ਆਪਣਾ ਸਮਾਂ ਕੱਢਦੇ, which we are seeing a lot of these practicing Sikhs and other communities all giving that time, helping everyone, which is a big thing, which is a big, you haven't got words to describe the feeling you see. You feel so proud as one human community, one human being. You're all collectively trying to fight against COVID.
Ankuji, it's a remarkable and overwhelming feeling to be a part of this, and with so much goodwill. This vaccination center, I think, can also be described as a melting pot for goodwill. When we first had the inspiration, when we were first given the inspiration to engage in the seva of vaccination, the mindset and ethos was not just giving an injection, it was actually about service to humanity. Apa
Sure.
Punjabi ch kehne sarbat da pala,
बिल्कुल जी।
goodwill for all God's creation.
Sure.
And it is with that mindset of service, selfless service, and service beyond oneself to help one another as a human family that this vaccination center has come into fruition, the Nishkam COVID Vaccination Center. The other thing is, this is, I think, something very unique.
Yeah.
I'm not sure that there is another identical model in the country, in that every person over here is 100% volunteer.
Okay.
So we have about at least 30, perhaps more than 30 healthcare professional volunteers. Doctors, dentists, pharmacists, physiotherapists, a melting pot of volunteers from the
Okay.
healthcare profession who are doing whatever jobs that they do, and then they're coming here to vaccinate because they believe in this. It is,
Sure.
as Dr. Al had said, it's a vocation. But it's not just the healthcare profession. We have people from the fire service.
Yes.
You know, they're also doing their day-to-day jobs and they're going beyond themselves, and many other such examples. And actually, you know, there are people that are doing security seva, people that are doing cleaning seva, and it takes every one person coming together and sharing their little spark of goodwill
Sure.
to create what is this vaccination center. That's something really special.
Yes.
And
That
one
we
is
can
very
see.
grateful to the volunteers and to God above for
Definitely.
this.
And the other thing is, Manviji, it's the message to everybody, because like, so with the social media, you have a very good and also the negativity of sometimes the wrong message going out. What would you say as a take-home message for everyone?
3 messages, if I may.
Sure.
First of all, a big thanks to the NHS for allowing us to collaborate with them
Yeah.
and for prioritizing our safety. A big thanks to all the goodwill and the volunteers at this vaccination center and everywhere in this country.
Sure.
The nation has shown so much goodwill. And thirdly, but very importantly, the vaccination is safe, it is effective, and I would humbly suggest, if you don't want to get vaccinated for yourself, then get vaccinated to protect the people you love and you care for.
Thank you very much. We pray to the Almighty to give you strength and courage to carry on doing the seva which you guys are doing. Thank you very much.
Thank you so much.
ਸਾਡੇ ਨਾਲ ਇਸ ਵਕਤ ਵੋਲੰਟੀਅਰ, ਕਿਉਂਕਿ ਬਹੁਤ ਵੋਲੰਟੀਅਰਸ ਇਸ ਵੈਕਸੀਨੇਸ਼ਨ ਸੈਂਟਰ ਤੇ ਸੇਵਾ ਨਿਭਾ ਰਹੇ ਹਨ, ਭਾਈ ਆਗਿਆਪਾਲ ਸਿੰਘ ਜੀ, ਜੋ ਕਿ ਵੈਸਟ ਮਿਡਲੈਂਡ ਫਾਇਰ ਸਰਵਿਸ ਦੇ ਇੱਕ ਨੁਮਾਇੰਦੇ ਹਨ, ਉਹ ਵੀ ਇੱਥੇ ਆ ਕੇ ਆਪਣੀ ਸੇਵਾ ਨਿਭਾਉਂਦੇ ਨੇ। ਭਾਈ ਆਗਿਆਪਾਲ ਸਿੰਘ ਜੀ, ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ ਫਤਿਹ। ਆਪ ਜੀ ਇੱਥੇ ਵੈਕਸੀਨੇਸ਼ਨ ਸੈਂਟਰ ਵਿੱਚ ਸੇਵਾ ਨਿਭਾ ਰਹੇ ਹੋ, ਕਰ ਰਹੇ ਹੋ, ਕਿਸ ਚੀਜ਼ ਨੇ ਆਪ ਨੂੰ ਇੰਸਪਾਇਰ ਕੀਤਾ ਕਿ ਆਪ ਜੀ ਆਪਣਾ ਸਮਾਂ ਕੱਢ ਕੇ ਇੱਥੇ ਆ ਕੇ ਸੇਵਾ ਵਿੱਚ ਹਿੱਸਾ ਪਾਓ?
ਪਹਿਲਾਂ ਤਾਂ ਸਿੱਖੀ ਵਿੱਚ ਹੈਗਾ, ਆਪਾਂ ਸੇਵਾ ਕਰਨੀ ਚਾਹੀਦੀ ਆ
ਜੀ।
ਤਾਂ ਜਦੋਂ ਸਾਨੂੰ ਵੀ ਮੌਕਾ ਮਿਲਿਆ ਇੱਥੇ ਸੇਵਾ ਕਰਨ ਦਾ, we didn't hesitate at all.
Okay.
ਦੂਜੀ ਗੱਲ ਹੈਗੀ, I work for the West Midland Fire Service, ਤਾਂ ਸਾਡਾ ਚੀਫ Phil Loach, ਉਹ ਵੀ ਕਹਿੰਦਾ ਬਾਹਰ ਜਾ ਕੇ ਸੇਵਾ ਕਰੋ। So he's encouraging us as well. So he's saying, as firefighters, we should be protecting the community in a lot of different ways. So we need to make the community safer, stronger and healthier. So when Nishkam Trust worked with the NHS to bring this vaccination centre to the centre of the community, because that's where it is needed,
Sure.
in the centre of the community, there's no reason why I wouldn't get involved. So I was very, very privileged to come and do some vaccination seva here as well.
And Agyapal Singh ji is also an OBE as well.
MBA.
MBE. Can you just share that with us? Why was that you were gone to that?
I work at the West Midlands Fire Service for a number of years. I'm also a volunteer of the United Kingdom International Search and Rescue Team, which means that I deploy to earthquakes all over the world. So the last earthquake that I went to with the West Midlands Fire Service and the ISAR team was to the Nepal earthquake in 2015. But I've also been to the earthquake in Indonesia in 2009 and had a lot of opportunity to do seva all over the world for kids and underprivileged children and things like that. And I was very, very honoured to receive an MB from Prince Charles, so I was really, really honoured. So.
And you're involved with a lot of other different community sevadas are coming here and doing the seva. It's something which you very rarely see in this Western world. Everybody's now involved.
Well, sometimes what happens is you see in other vaccination centres and other places, people are doing seva, but they're getting paid for the seva.
Sure.
This is, I think, one place where all the volunteers are doing it because they want to be part of this. This is a big thing. You know what? When we talk about World War One, we talk about World War Two. In years to come, our children, our grandchildren will be going saying, and what did you do? Yeah. Granddad, what did you do? And I want to be able to say, yes, I did my bit in this pandemic.
Thank you very much. Waheguru bless you to carry on doing this.
Waheguru.
ਗੁਰੂ ਪਿਆਰੀ ਸਾਧ ਸੰਗਤ ਜੀ ਕੋਸ਼ਿਸ਼ ਕੀਤੀ ਹੈ ਕਿ ਜੋ ਇਸ ਕਰੋਨਾ ਮਹਾਮਾਰੀ ਦੇ ਵਿੱਚ ਜੋ ਵੈਕਸੀਨੇਸ਼ਨ ਸੈਂਟਰਸ ਯੂਕੇ ਦੇ ਵਿੱਚ ਹਰ ਜਗ੍ਹਾ ਖੁੱਲ੍ਹ ਰਹੇ ਨੇ, ਉੱਥੋਂ ਆਪ ਜੀ ਨੂੰ ਕੁਛ ਜੋ ਜਿਸ ਤਰ੍ਹਾਂ ਵੈਕਸੀਨੇਸ਼ਨ ਸੈਂਟਰ ਆਪਰੇਟ ਕਰਦੇ ਨੇ, ਕਿਸ ਤਰ੍ਹਾਂ ਵੱਖ-ਵੱਖ ਧਰਮਾਂ ਵਾਲੇ ਵੱਖ-ਵੱਖ ਹਰ ਕੋਈ ਇਸ ਬਿਮਾਰੀ ਨੂੰ, ਇਸ ਮਹਾਮਾਰੀ ਨੂੰ ਹਰਾਉਣ ਦੇ ਲਈ ਲੱਗੇ ਹੋਏ ਨੇ। ਸੋ ਆਸ ਕਰਦੇ ਹਾਂ ਆਪ ਜੀ ਇਸ ਪ੍ਰੋਗਰਾਮ ਨੂੰ ਪਸੰਦ ਕਰੋਗੇ। ਆਓ ਲਈਏ ਜੀ ਆ ਗਿਆ। ਵਾਹਿਗੁਰੂ ਜੀ ਕਾ ਖਾਲਸਾ, ਵਾਹਿਗੁਰੂ ਜੀ ਕੀ